According to Panay Monthly, kidney disease is the silent killer. A person can lose up to 90% of his or her function before experiencing any symptoms. We typically take our kidney function for granted. Our kidneys filter waste, monitor and manage our fluid balance and our electrolyte balances. When our kidneys fail, there are 4 options to choose from: transplant, palliative care, hemodialysis, and peritoneal dialysis. Also, according to Panay Monthly, kidney transplantation may be the best therapy as it eliminates the need for dialysis and helps the patient live a longer life. But it is not a procedure that we need to rush into. Being a dialysis nurse, I would like to talk to you today about the 2 most considerable choices. We will talk about what is dialysis and the differences between dialysis and peritoneal dialysis. What is dialysis? Dialysis is a treatment that replaces the process originally done by your kidneys. When the kidneys fail, dialysis will keep the patient's body in balance. The dialysis is referred to as artificial kidneys. Now that you know what dialysis is, let's talk about hemodialysis, our first modality. Hemodialysis is a process of removing blood from an artery, dialyzing it through a filter, and giving it back to a patient through a vein. There are 2 types of hemodialysis a patient can choose from: in-center hemodialysis and home hemodialysis. In-center dialysis consists of nurses and techs that help place the patient on a machine for the day. According to the National Kidney Foundation, a patient is on hemodialysis for 4 hours of treatment and 3 days per week. Their schedule is set by the availability of the clinic. There are 2 types of hemodialysis access: a catheter and a fistula. The most common risk factors for hemodialysis are low blood pressure, cramping, fluid overload, and anemia. The Mayo Clinic website on hemodialysis states, although in-center 3 times a week hemodialysis is more common, some research suggests that home dialysis is linked to better quality of life, increased well-being, reduced symptoms and less cramping, headaches, shortness of breath, improved appetite, sleeping patterns, energy level, and the ability to concentrate. Let's talk about hemodialysis at home. Home hemodialysis can be done in the comfort of your own home. Treatments can last anywhere between 2 hours and 4 hours, and 3 days a week to 7 days a week, depending on which cycler the patient chooses. Training for home runs from 3 weeks to 3 months, depending on the needs of the patient and the caregiver. Most facilities require patients to have a partner to help with their treatments. Compared to hemodialysis, peritoneal dialysis is associated with the increased autonomy and flexibility, better preservation of renal kidney function, improved hemodynamic stability, and low cost. This is according to the Dialysis Modality and Survival Done to Death. Let's talk about peritoneal dialysis. Peritoneal dialysis is done through a catheter that is placed into the peritoneal cavity. The catheter will help transfer solutions to and from the patient's peritoneum. Patients must have an aseptic area to make sure all exchanges are done properly. There are two ways to perform peritoneal dialysis. There's continuous ambulatory peritoneal dialysis and automated peritoneal dialysis. Continuous ambulatory peritoneal dialysis consists of doing a manual exchange. Exchanges consist of draining old solution from the patient's peritoneal cavity, filling the peritoneal cavity with new dextrose solution, and dwelling in the peritoneal cavity anywhere between 4 to 6 hours. This exchange is done 4 to 5 times daily and can be very time consuming. With automated peritoneal dialysis, the patient uses a machine that is set up with dextrose solution that the patient will use during the night. Typically, they are placed on their machine anywhere between 8 to 10 hours while they're sleeping. The cycler automatically does their exchanges as prescribed by the doctor while the patient is sleeping. Majority of the patients are able to lead a very normal daily activity. This modality is very friendly with younger adults and kids due to having to work or going to school. Training is typically 1 week or 2, depending on the needs of the patient again, and the most common risk factors are hernias, infection, and weight gain. In conclusion, I'd like to talk to you and let you know that patients with chronic kidney disease have a lot to think about when faced with this difficult choice. This decision is not one to take lightly, as dialysis is a difficult lifestyle change. If they are not educated, they may end up with the wrong modality for their lifestyle. I have given you this information in the hopes that you will be more informed on the types of dialysis that are available to your patients. Do not take this choice lightly, as it is and can be a life or death choice.